I've seen a couple of people in my practice who have thought that I was a psychiatrist or a psychologist. I think that it must be quite confusing for people who are in mental distress when they just want to look for someone to help them to have so many different terms, like how do you differentiate whether you should get help from a psychiatrist or a psychologist, or is it a counselor? So what's the difference between all these people? Let's look at them. Let's start off with a psychiatrist. A psychiatrist is a medical doctor who has finished medical school and went for specialization in psychiatry. When he or she is in R5, 5th year of residency, once the person gets through the examination and goes for accreditation and it gets approved, the doctor needs to register with the medical council. So in Singapore, it's the Singapore Medical Council before he or she can call himself or herself a psychiatrist. Because psychiatrists are essentially medical doctors, they are able to prescribe medication as well as order for tests, like for example neuroimaging or other blood tests, and they can also order a patient to be warded. A psychiatrist practice using the medical model and will first try to understand where the problem is and also to exclude other possibilities. Like for example, if a person has symptoms, is it because of other medical reasons, like for example diabetes or neurological problems, if there are spasms, or if let's say there are seizures, or is it due to other nutritional or other organic reasons or related to medication. So after excluding all other medical problems or sources, the psychiatrist will make a diagnosis and order treatment for the patient. So it could be medication, like for example antidepressants if a person has been depressed, or other behavioral treatments or interventions, like for example maybe an ECT, electroconvulsive therapy, or maybe even counseling or psychotherapy. A psychiatrist in private practice will usually charge between $300 to $400 per consultation for an hour, but you also have some of them who will charge for their 15 minutes or half an hour of consultation, and it ranges between $120 per 15 minutes to about $200 for every half an hour of consultation. Then again, this excludes medication. Medication with a psychiatrist can be quite expensive. So a patient can take maybe 4 to 6 different types of medication, of which each pill costs around $4 to $6 every single day, and so it adds up to quite a lot. The psychiatrist may prescribe the medication for the month or half a month worth, or maybe for long-term patients they might prescribe 3 months worth of medication for them as well. So that's possible. Apart from working in private practice, many other psychiatrists work in hospital settings, and the rates they are charging will depend on the hospital. Some of them have subsidized rates and others don't. You can check out the rates at the IMH website, which is stated here right now, and you can find out about their rates. So to summarize, a psychiatrist is a doctor, and you are seeing the doctor because you are sick and you are a patient, so you need help. What the doctor does then is to find out what's your problem, to give you medication, or to prescribe interventions for you to get better. So this is a psychiatrist. Next, we have the psychologist. The psychologists that are in practice are usually ones who have a master's in psychology, but we also have a few of them who are employed just with their bachelor, maybe in the public sector or something like that. The training for a psychologist involved using the scientific method to set hypotheses and to test them out, and then to use evidence-based methods and studies to provide treatment and interventions. So this group of people, they usually engage in diagnosis as well as psychological testing. Then they provide interventions based on research to improve a person's condition or to help the person sustain the condition through their life. There are many different types of psychologists. So you have the education psychologists, forensic psychologists, clinical psychologists, social psychologists, occupational psychologists, just to name a few. And each of these psychologists will do different types of things. So like, for example, a clinical psychologist will usually look at the population with mental illness, and the main job for them is to look at patients to see whether they have certain disorders and to diagnose them. For educational psychologists, they will be looking at children and working with them to find out their IQ scores, to see if they have autism and what is their memory like, and whether they have attention deficit disorders or whether they have autism. So a lot of testing for them. For occupational psychologists, they will be looking at giving career guidance, like for example, which direction to go to, which vocation to take up, and etc., using psychological testing and some of the tools that they have, like card sorting and etc. Forensic psychologists may engage in profiling to see the likelihood of the criminal and to help catch them, etc. They might also determine if the criminal or the person who is caught has a mental illness or not. Apart from testing, the psychologist also provides intervention. So it could be interventions to improve, like for example, in the case of an educational psychologist, it will be perhaps teaching the child phonics or applied behavioral analysis, ABA, for the kids with autism, so that they can show socially appropriate behaviors. For children with dyslexia, they may go through trainings and interventions for them to learn how to read words in a different way with the educational psychologist. The rates for psychologists are usually between $120 to $250 per hour for consultation, and this excludes psychological testing. Psychological testing will usually cost about $600 to $1,000 over dollars just for the testing itself, of which some of them will actually take about 1 or 2 hours for occupational or social emotional or mental health testing. But for those that's related to performance, achievement, IQ, learning, and etc., these testing usually takes about 2 to 4 hours long, and they will probably cost more. So this rates is just for the testing. The report itself will have a different set of charges, also ranging between $600 over dollars to $1,000 over dollars, and it depends on the complexity and the length of the report itself as well. For example, if it's IQ testing using WISC, the report itself may take a few hours to generate for each individual child, so it costs quite a bit. So all in all, if let's say a person goes for a visit to a psychologist and requests for psychological testing and requests also for a report, the cost may go up to about $1,000 to $2,000 depending on what type of issues are dealt with. A psychologist may work in a private sector, having their own private practice, or they may work with the government and other related sectors. For example, in Singapore, we have many different psychologists working in the Ministry of Defense, with MINDEF, or they are with SAF. You also have psychologists working in the prisons and in the Ministry of Education as educational psychologists. Last, you have those who work in IMH, in the Ministry of Health, and they are working in conjunction with the psychiatrist, as well as the social workers and counsellors to support those with mental health issues. Next, you have a counsellor. A counsellor in practice is usually someone who has a master's in counselling or master's in psychology, and this person usually works with people, and they call them clients, with day-to-day life problems. Like for example, if you have suffered a loss, or if you had a very angry outburst or something, you had a dispute, you have something that's troubling, you can't make up your mind about something, or that you have been crying for days, because of something that happened. So these are the times where people go and look for a counsellor to get help. The rates for counselling are usually also like the psychologist for the consultation. So it's between $100 to about $250 an hour. In Singapore, you have counsellors who work in various settings, like those who work in a school setting, school counsellors, or that they work in private settings as private practitioners, or they work in family service centers, or maybe at the courts, or in the prisons, or in the hospital setting. So counselling can be a job function, or it can be a job title, the counsellor as a job title. The problems that the counsellor deals with are more pragmatic, short term, and it's more about problem solving. So like for example, just now I talked about maybe coping with a loss. So it could be coming up with interventions and tracking, and to give a listening ear for the person in grief, and for the person to gain certain insights as to how to cope or to move on. These are usually more short term as compared to psychotherapy, which is our next group of people that we talk about. Psychotherapists are people in private practice. I don't think that there are any psychotherapists which is hired by any government sector or in other sectors out there. So with a psychotherapist, it's the client is the one who wanted the service. A psychotherapist is hired privately by the client and is paid by the client directly, and in this case there's no other governance about this, and so most of the information in the sessions are kept confidential. There's no need for case discussions, like for example with the psychiatrist, they will have maybe case discussions for a community approach to help the patient. But with psychotherapy, it's usually one-on-one, and unless the court demands for the case notes, etc., or that the client is looking into self-harm or harm of others or the society, otherwise the psychotherapist will keep everything confidential. A psychotherapist usually looks at more long-term issues and work, so like looking into the childhood or the unconscious to see why the client feels a certain way. Maybe there's a certain lack of satisfaction in the life, and the person wants to look at how to change the feelings and to think or behave or to be themselves in a different way. So it's more of a life-changing maneuver or intervention, and it usually takes a longer period of time than counseling. In Singapore itself, there's not much difference between psychotherapy and counseling. So counselors do offer psychotherapy as well, and psychotherapists does do short-term pragmatic problem-solving work as well. A psychotherapist charges similarly to a counselor, so about 100 to 250 per hour for their services. Okay, you have the last group of people, the social workers. Social workers look into the life-related problems of a person and their family. So like for example, housing or money or food or health, or like for example family support for the marginalized, for those who need help so that they can actually have an equal chance in succeeding in life for themselves or for the family members. And social workers typically only work in agencies. I don't think or know of any social worker in private practice in Singapore. But again, social worker itself can be a job role or job function, but it may not be related to the training. In Singapore, usually a social worker has minimally a master's in social work, or master's in counselling, or master's in psychology. But you also have social workers who do not have the master's and they were hired just based on their bachelor degree. Because social workers work in agencies, the charges will depend on the agency itself, but usually you do not for example, if the person wants to go to a family service center to look for help, a person is trying to get counseling and will be paying for the counseling session rather than paying the social worker. And you are not paying for social work sessions, you pay for counseling sessions. But you might be seeing a social worker who is conducting or giving counseling sessions and charging at the agency's rates. So you find that this thing about job function and job title in the midst of these terms. You have social workers working in various sectors in Singapore, like for example in the Ministry of Social and Family Development, MSF. So it could be working with child abuse or family violence cases, or maybe working in the courts. They may be working in the family service centers, or they may be working as medical social workers in the hospitals. So these are some examples of where social workers work in Singapore. Okay, so I've described what a psychiatrist, psychologist, counsellor, psychotherapist, and social worker does. So what are the differences and the similarities, and who do you look for when you need help? Okay, this is how I will group them. A psychiatrist and a psychologist is someone you look for if you have problems and that you need a diagnosis. You look for a psychiatrist when you need medication, or if you need to be warded or something, because a psychiatrist is a medical doctor who can give you medication. A psychologist can actually help you do psychological testing to test you, like for example for depression, for autism, what's your IQ like, whether you have ADHD, whether you have a personality disorder, or something like that. In Singapore, a psychologist is unable to prescribe medication, and it's like that for the rest of the world as well, except for some parts of America where they have this thing called prescribing psychologist. But it's not in Singapore. So in Singapore, a psychologist will be able to give you a diagnosis, will be able to do psychological testing, and will be able to give you interventions. Sometimes a psychologist will give counseling interventions, and some others will give instructional ones like skills training, like ABA, which I mentioned earlier, applied behavioral analysis, or that they will help like people with dyslexia or with autism to learn some skills in which they can cope better with, let's say, their studies or with society. And then you have the counselors and psychotherapists. Like I said earlier on, counseling and psychotherapy in Singapore are actually the same. There's not much differences. People who come in for counseling may decide to work on long drawn issues, or that people who go for psychotherapy may decide to terminate after 1 or 2 sessions when their needs are satisfied. So it's similar in Singapore. A counselor and a psychotherapist sees human suffering as part of life, and that it's normal and natural to seek help when you need. Of course, among all these people that they see, they also see people with mental illness or a diagnosis as well. But the therapy tends to go on a note whereby they will try to look into what are some of the habits, or what are the beliefs that they have about, let's say, people or themselves, which led them to having a diagnosis or having certain behaviors in the end. So in one of my broadcasts earlier, I've spoken about how some of the mental disorders require therapy to work hand in hand for the client to recover. Medication usually decreases the symptoms or the danger for the client and maybe improve some of the physiological functioning and etc. But it does not change their beliefs and the habits or the emotions that cause all these problems. So it has to go hand in hand with therapy, which is usually conducted in counseling or in psychotherapy for the person to get better. Okay, like I said just now, or in counseling and in psychotherapy, the person who sees them is known as a client, a person who has normal problems in life and etc. Even with a diagnosis. Okay, even if let's say the person is diagnosed with depression, the person is still seen as a client, as opposed to being seen as a patient in the eyes of a psychologist or a psychiatrist. You also have social workers. So social workers help those who are marginalized or underprivileged to get resources they need from the government. So you go and see a social worker to get help, to be connected to resources if you need. If you have emotional distress and that you find is normal and that you just have difficulty handling or dealing with, or that you want to make lifestyle changes in your life that improves your satisfaction, etc., you go to a counselor or a psychotherapist. If you feel that you need a diagnosis and if you feel that you need medication, you go to either a psychologist who can give you a diagnosis, or you go to a psychiatrist who can give you medication. I mentioned about job roles and job functions just now. In Singapore, this can be a bit confusing. So like the social worker can be doing counseling, or a person who's trained as a counselor can work as a social worker. A psychologist can be practicing as a psychotherapist or a counselor. It depends on whether you are looking at the role. So are you looking at this job this person is hired to do, or are you looking at the training of a person? In Singapore, a counselor and a social worker is a job role. So you can be hired as a counselor or social work in Singapore, but your training might be in counseling, social work, or psychology. A psychiatrist has a training in psychiatry, but he or she may also practice psychotherapy and counseling with their clients. A psychologist is hired for his or her training, but he or she may be actually doing counseling or psychotherapy as well. And he or she may decide to call himself a psychotherapist or a counselor as well. So all in all, these are the people who you seek help if you have mental health issues. The general broad strokes are that diagnoses are given by psychologists or psychiatrists, and if you are in emotional distress, you go for a counselor or a psychotherapist, or you can also go to a social worker who may or may not have the training to support your mental health needs. But a social worker will be able to link you up to resources. So let's say your problems and your disputes and quarrels in family is because of money or because of addiction problem or something. The social worker might be able to link you up to food coupons, or maybe help the person who has an addiction problem to go into detoxification, maybe get subsidies or scholarships for the children who study, and other financial resources or financial aid that's possible. At the end of the day, these are all mental health practitioners who can help people with issues that cause them emotional distress or psychological distress. And oftentimes, all of these individuals and professionals do work hand in hand, and they can cross-refer you. So let's say if you are to see a social worker and that he or she finds that you have emotional distress, and needs help in that area, he or she can refer you to a counsellor. Or if let's say you probably have depression, then you might be referred to a psychiatrist. Or if let's say there are personality disorders, or let's say autism in the child, then the child might be referred to a psychologist. So it's actually okay for you to seek help from anyone, because we can all cross-refer. However, having said that, then maybe the rates and the charges will be the issue as to who you want to seek as a first line help. The rates to seek help in the private setting and that of a public setting will be very different. In that, if you are to seek help from the public setting, like for example in the family service center, or in the polyclinics, or in the hospitals, the rates will of course be very different from if you were to seek help in the private setting, those in private practice. But having said that, the caseload for those who are actually working in the public sector is quite high, and there may not be any guarantees of what is their credentials or their qualifications. Of course, psychiatrists will have to have their credentials. They need to pass the state exams, etc. But like I said earlier on, in the public sector, you may not know whether the social worker or the counsellor or the psychologist that you are seeing have a master's degree in their relevant field as per what is the industrial standard, because they could be hired just with a bachelor, and you don't usually ask your therapist or your social worker for their qualifications before you go for treatment, right? And apart from that, the caseload in the public sector can be very high as well, which may lead to a lot of burnout and maybe attrition. So in any case, it's your call as to who you want to look for to get help. Just look for help if you need to with any of these professionals, however it is, because if you're to wait, a mental health issue, which may be very small, may be very situation specific, or that is due to a certain incident that happened, may become a huge issue with a mental health diagnosis, and that you might need to go on lifelong medication. So don't wait until you need to use medication for life. Okay, so hopefully I've managed to clarify some of the professions and terms, and that you now know better who you might look for if you need help or if you are in emotional distress. Thank you for watching today. See you again, and bye bye.